it. No, hit the red. You didn't do it. Good. All right. Okay. Okay, welcome back, everyone. I told you, so we had a talk. We all got personal, right? A little bit? Yes. Okay. And now what we're doing is, what's your name again?
Anna.
Anna. We're going to work on Anna because what happened, Anna? Can you speak up?
Yes, I had an accident.
Okay, speak louder.
I had a car accident.
You had a car accident, okay.
4 years ago.
She had a car accident. 4 years ago, she had a car accident.
Yes, and I cannot lift my arms.
And you cannot lift your arm up. And she had whiplash. Now, let's understand something. First of all, car accidents are traumatic. Now, depending how you process chaos and trauma will depend on how bad the accident is. Does anybody know, okay, what PTSD is? What is it? Yeah, no, they called it post-traumatic stress disorder. Why? No, because guess what? It's actually shell shock. And they changed the name from shell shock to that because that's what happens when you go to war and you go over and you hurt people. You're going to come back shell shocked. And when you go and the shells are going off and there's bombs going off, you're going to be shell shocked. Human beings, it's hard for human beings to hurt people. You get shell shocked. And when you do things that are against loving and caring, you're going to get shell shocked. So they changed the name to PTSD to make it look like it's a syndrome or some kind of condition when it isn't. Now, think about all the people in your family that have shell shock. And why do they have shell shock? Because guess what? When you go to a practitioner that cannot and will not, because they don't know what they're doing, most practitioners don't, God love them anyway, but they don't understand that when she got in the accident, she had tears in the tissue. That's what happens. You tear the tissue, whether it's the tendon, whether it's the cartilage, whether it's the muscle, whether it's the organ, whether it's the ligament, it doesn't matter. It's always a tear. And wherever there's inflammation, there's going to be calcification and scar tissue formation. If it's really bad inflammation, you're going to pull calcium from the bones to buffer it down because too much inflammation causes mutation. Did you know that? So the calcium buffers it down, and that's why people will have a lot of calcium in their blood when they're really stressed out or they eat a lot of sugar, a lot of flour, drink a lot of alcohol, or stress themselves out. You'll have calcium in your blood to try to buffer down the blood, because if your blood gets too acidic, you'll go into a coma or die. Did you know that? Yeah. So that's why you keep pulling calcium out of the arterial walls and out of the bones. Okay. So what happens is now every time, how long ago was this? 4 years ago. So now she went to a chiropractor, but guess what? It only gives her temporary relief. Yes or no?
Yes.
Yes. And because it's chiropractor tries to put the joint back into place, but guess what? You can't do that. You can't force the joint back into place because what did I tell you? When you tear anything, the body replaces it with fibrin. And the longer the inflammation is in there. Does anybody know what inflammation is? Inflame. That means you're inflaming. So what does that mean? That means that the tissue that's inflamed turns into beef jerky, which means it shrinks and it dehydrates. And that means that, guess what? How many people have eaten beef jerky? If it can be 1/4 of an inch thick, how many people know that that 1/4 inch used to be 1 1/4 inch and then they dehydrated it? So that's what's happening in here. So when she goes, oh, I'd like to lift up my arm the way I used to, and she goes to do it, she feels pain. And then there's micro tearing. So now she inflamed it more. So every time that you go to do that, you hurt yourself, don't you? Mm-hmm. Oh, I forget, or I just want to be normal again. Okay, oh, I'm going to force it. I want to be able to brush my hair. You know, I want to be able to wipe my butt. I want to be able to do things. So you go too far. And guess what? Is scar tissue elastic? No, you can cause micro tearing. So she's continually causing micro tearing. I'm going to prove to you tonight that what we're going to do is we're going to use the Cellsonic. The Cellsonic, everyone, let me see. Let me give them a little view of it. I got it. Okay. We'll move this when we have to. I got it. No. I got it. Okay, so there's the Cellsonic. That puts out 25,000 volts. I mean, what it's plugged into is 120. Put your finger in there. Can somebody come here and put their finger in there? You know, you can give yourself a seizure or a heart attack. When we do this, it's 25,000 volts that gets put into a field. Do you understand? It's still 25,000 volts, but it's in a field now. Now, what does that mean? That means that it has the healing potential. It actually still has the healing potential. Are you ready for this? It's 25,000 volts. How many people know that this will actually decalcify the mitochondria in a cell instantly with one pulse? How many people know that when bones can't grow together, Cellsonic can help them grow together? How many people don't know that it'll actually help to reactivate nerves that they say, oh, the nerve's dead, it'll never come back alive? Well, with the Cellsonic and doing non-surgical, I can prove to you that even people who have stenosis, oh, the nerve's dead, you're going to have surgery. It takes us 25 to 30 minutes to bring the nerve back and to get rid of that dull pain or to get rid of that sciatic running down their back. How about this? With non-surgical and Cellsonic, and even with just the non-surgical, we guarantee you're not going to surgery. When they tell you that you're bone on bone in your hip or in your knee, that's a lie. And I don't mind if any surgeon or any doctor wants to come on and give me a call at 469-861-9454, and we'll debate this. And they'll go down softly, very quickly with me, because it's not true. Because understand something, you can only have 10% cartilage left, or even 5% or even 2% cartilage, which we never have that much. They say you don't have it because guess what? If you're inflamed, you pull calcium and then the tissue becomes calcified. It's still there, but it's calcified. What happens when you get rid of the calcium? The tissue's still there. They don't look at that anymore. What does a doctor say? We'll keep an eye on it for you. And then when it gets really bad enough, they'll give you a false hip, a false knee. They'll give you a mesh. They'll give you a stent. They'll give you a rod. They'll give you screws. They'll give you plates. Okay? They'll give you a new stent in your heart because they're always waiting for it to get bad enough, right? Because they know nothing about reversing scar tissue and getting the calcium back into the bones. It's not their job. So that's all they do is surgery and drugs. And I'm not trying to put them down. Do they offer a money-back guarantee? They're going to reverse it. Understand something with Cellsonic and with a cardio med bed, which we call, people can go to what's called the powerpack.health. Those two devices plus non-surgical. Somebody can come to us with a 92% blockage in their heart. You know that's huge, right? You do know that in 35 hours of treatment, we'll have it completely reversed and a new set of arteries in there. And that's research and science. And we have all the science to prove it. The reality is everything is about what? Circulation. If you have perfect circulation, what do you got? Perfect what? If you have perfect circulation, perfect health. And every place where you have what you call a disease, your circulation is lower. It's not perfect, is it? No. So if you don't have circulation in a certain area, why don't you? It's a calcium or scar tissue block. How many people know that? That's all it is. So guess what? People are getting legs cut off. They're getting hips cut out. They're getting knees torn apart. They're getting shoulders torn apart, wrists torn apart, spines torn apart. And it can all be reversed because the human body's amazing. But guess what? In the world of medical science, okay, diet has nothing to do with health. Exercise hardly has anything to do with health. And if they tell you exercise, it's crappy. It's hurting you. Okay, remember something, they don't believe in anything except what? Medication and surgery. Yes or no? Am I making this up? No. Okay, so the reality is don't blame them. Why do people get pissed off at their doctor when their doctor's not in health? I mean, people call me up, I hate my doctor, I hate my doctor, I go, he's not a doctor, he's a physician or a surgeon. And why are you mad at him? You know that he only does drugs, surgery, radiation, and chemo, and that's all he does, but you're pissed off at him. You're the fool. Does anybody get this? Oh, how about this one? The medical system is broken. How is it broken? They're doing exactly what they were trained to do. They're not meant to do anything else. They're not there to heal you. They're there to numb you out. They're there to take away your pain very quickly and not teach you how to become the master of your pain, the master of your body. Yes or no? So why do you keep getting mad at them? Stop. Leave them alone. They're doing exactly what they were meant to do. People don't think. But then you still keep going back, don't you? Because you're the one that doesn't take responsibility for your own health. Because you only have 4-inch consciousness. You'll eat anything. You'll drink anything. And guess what? You won't even realize that your large intestine is the holy grail. And the whole immune system of your body depends on your large intestine. And you treat it like crap. And if you take a look, most people look like crap, don't they? Their intestine's either falling down or out, or it's sticking out like as if they just ate a beach ball, a big one. All right? You know, that must be that whole thing where men can now give birth because they look like they're pregnant. Is that what's going on? I don't know. I'm confused. Okay, so let's get back to this. So try to lift your arm up as much as you can. That's not so bad, eh? But what's the problem? Where do you feel it? In the back? Yeah, and guess what? It's actually not coming from there. I'll show you where it's coming from. This is called the bicipital groove here. And remember, we didn't bring you on right away, but guys, I had you come close enough, right? You were about 1.5 feet away, and you could hear all the crunching and the cracking when I was using my elbow on a 45-degree angle to prove that she's all calcified in here and crystallized, and that the tissues in here are beef jerky now, right? Did I prove it? Okay, so now that's proven. So the reality is we know that she's not going to have that flexibility, okay? And that's everyone. So everybody with any problem, I don't care what it is, it's a scar tissue, displaced calcium, crystallization problem, and everybody can have it reversed. I don't care where you are. Are you still alive? You can reverse it. Are you willing to do it? Most people have given up already, right? I just can't take it anymore. So thank God that we do have the medical system because they can drug you out and numb you out, okay? Because if you're not willing to take massive personal action and stop being the terrorist, then thank God we have the medical system, right? Because a lot of people, let me tell you something, would have killed themselves already if they couldn't be on drugs. But at least now they're just like this. What? And they're not killing themselves or their family. So that's a good thing. So if you're not willing, and you're not willing to take massive personal action, or you don't believe that you can heal yourself, it's a good thing we have them, but it isn't. Because medical doctors are the third leading cause of death in the United States. How many people know that? Well, they are. And they actually help with the first and second one, which is what? Heart disease and cancer. Because if we are actually really wanted to help people, we would let people know that broken hearts are what cause most heart disease. And cancer is corruption, contamination, and conflict within here first. And it's a little bit of hate and a little bit of anger mixed up. And when you hate and you have anger, do you eat right? Do you think right? Do you treat yourself with love and respect? No. Okay. All right. So first thing we're going to do is you're going to hear a clicking noise, okay? And it's not going to be painful for her. I'm just going to bend this a little bit so people can see what I'm doing, okay? So it won't be painful, but you'll hear it, okay? A popping sound, all right? And that popping sound is 25,000 volts going in as a field. Now, it has the ability to decalcify mitochondria instantly. I'm telling you it does. It can shut down stage 4 inflammation in a cell instantly. I'll first just do the Cellsonic on her. Then after we do that, we'll do the non-surgical, and then she'll tell you how she feels. And I only want you to be honest, okay? All right? Let me just shake it. So you have to shake it first because there's a fluid base in here that will take that 25,000 volts, okay? Okay. Now I'm going to tell you a couple stories before we start. Don't do it yet. Okay? Just like I said here before we came on, and this is the truth. So in the last 2 weeks, and if anybody wants to call me or they doubt me, I can have you call up the therapist, and I'm sure that they'll give you the clients' names. That between the non-surgical and the Cellsonic, we have 2 patients in the last 2 weeks that had stage 4 cancer in their lungs. And they both got checked out, and the cancer's gone. Okay? One was in Florida, Stewart, Florida, and the other one is in Barrie, Ontario, which I'm heading there in 2 weeks. So we'll actually, I'll be doing a testimonial on the person. And I did a testimonial on the lady that no longer has the lung cancer. Now remember something, stage 4, and hers left in 6 weeks, and his was gone in 9. Do you understand? So understand, what is cancer but inflammation? How do they know? Well, because whether it's stage 1, 2, 3, or 4, it's just different degrees of inflammation. How many people know that? So there's the deal. That's how they do it. Because what do they do when they want to see how bad it is? They give you what? Radiated sugar. Radiated processed sugar goes directly into a cancer cell and it fires up the cancer cell. Do you think that maybe the radiated sugar might have taken it from stage 2 to 4? Because it could set it off that much, because sugar fires everything up, right? Okay. All right, so let's do it. You feel it now? Okay, this is where it was going crunch and crack, right? This is the displaced calcium. And right now, what am I doing it? You ever hear of fracking in the oil when they would go underground, that they would do fracking? Well, right now, I am causing little fractures to the calcium, and I'm also putting in frequency into the dried fiber, and I'm reviving the actual fiber. What is that?
It's 250.
Okay, all right. Really?
No, 156 up to the side.
Okay, just keep it going. Okay, thank you. Now here's where it was calcified, and I said it was calcified. She will be able to tell the difference. When I work on the non-surgical, it's going to be so much easier. You want to know what happens when we have a person do ionic calcium therapy and they actually do a proper diet? Okay, ionic calcium therapy, and we do Cellsonic and they do a proper diet. The actual calcium that's displaced from the bones, okay, that becomes hard as rock, actually will crumble like rice paper, and everything falls apart because we're putting, okay, does everybody understand that we are electrical, magnetic, light energy beings? Okay, do you understand that? Why do I have so much energy? Because I'm a high frequency being. There, do you hear that noise? We're hitting a large piece of calcium right now. You feel it? Mm-hmm. Yeah. It's all calcified in here. Now, how is anybody going to get rid of this calcium for her? So she would have to suffer with this for the rest of her life, or get some form of surgery. And then what happens after surgery? Well, you're even stiffer. Surgery causes more scar tissue and more displaced calcium. We're done? Good. So we just did 500 pulses. Now, watch when I go back in here, and it's going to be different. Everything is about light, everything is about frequency. Does anybody understand when you eat something, you need to ask yourself, how much light and frequency is in this food? That's what you're supposed to do. And most of you only eat dead food. Pasta, bread, okay? I could keep going, but I'm not going to. The reality is when I eat or drink something, and Rami will tell you, what's my diet like, Rami?
Oh, amazing. Fresh salads, juices.
Okay, I'm more interested, and guess what? I love eating healthy. I love the flavors. You know, the 99% of the population is addicted to drugs. You're all drug addicts. Okay? You don't eat for the flavor of the minerals, the vitamins. You eat for the chemicals that the tobacco industry puts in the foods, because the tobacco industry owns all food corporations. How many people know that? Okay. All right. Where do you think their money went to when they weren't selling as much cigarettes? They said, well, you know, what we did was we signed a pact with the devil, and we need to feed the evil entity. How many people know that there's an entity on this planet that gets off on your suffering? Okay? They don't want to kill you. They want you to be enslaved, and they want you to live a nice long life to at least 50, and then they want you to spend all your money on trying to get healthy because you don't even know what that is. Okay? And now all your money goes right back to them. It's just one big game. Okay? And they've got one big group, and guess what? One big club, and you're not in it. They just use that club to beat you up with. Feel the difference? See? Told you. Now we're going to go in and we're going to fix her. Okay? Feel the difference? It's all falling apart now. And that's what I just told you. So this device here will actually lovingly help a kidney stone crumble, help a gallstone crumble. How many people know that kidney stones are a pre-cancer situation? Well, come on. Why are you taking out so much calcium out of your bones that you've got kidney stones? Well, because you're so inflamed. And if you didn't do that, you might have cancer already. Are you understanding? So why do you think you have gallstones? Well, because you're making so much cholesterol, because you're so on fire. Remember, you're going to make cholesterol anyways. Cholesterol is a hormone that we all need. But you all have so much cholesterol in you because you're trying to goop up the cracks in your arteries because you're so acidic and you're so on fire. And the reason why you make so much cholesterol is your body wants to goop the cracks up with cholesterol because it's like candle wax. Because if a little calcium deposit gets into crack, it's like coral, and if it cuts it, a blood clot could come out, and that's where. How many people know that most heart attacks and strokes are because of that? You weren't told that, were you? Yeah. They didn't tell you that. They can't tell you that. Feel the difference?
Yes.
Day and night, eh?
Day and night.
Yeah. Welcome to true healing.
I can feel circulation.
Yeah, it's all back now. So we just put in 25,000 volts, okay, of 500 pulses. We've activated the mitochondria. And understand, does everybody know what mitochondria are? They are the powerhouse of every cell. They make the ATP that give you energy. Now, cancer patients, they don't make enough ATP anymore. They have too much damaged mitochondria. When a mitochondria get damaged, you know what happens? It sends out a frequency, and then the other cells make more ATP. But what happens is your mitochondria make ATP. That gets released out of the sodium-potassium pump into the extracellular fluid. And guess what happens when that happens? The ATP mixes with water and creates a lightning bolt, which creates a new cell. So the more damaged mitochondria you have, the less new cells you make. Did you get that?
Yes.
Okay. So we just repaired the mitochondria just with the Cellsonic. Okay, drop here. Just relax. See, she feels it. It's all falling apart, right? Mm-hmm. Remember before when I was here, it was just hard capped?
Yes.
It's not anymore. So I would have had to work twice as hard, twice as long. I wouldn't have accomplished as much. Remember something. What does every cell have? Every cell has a brain, has a spine, has a spleen, has a liver, has everything that you have. And guess what it has? Memory. Every cell has memory. So the cells in here have a memory that they need to stick together. They need to stay calcified. They need to stay contracted. And I just put in a high vibration, the highest vibration of any energy medicine device is a Cellsonic in the world. I just put the highest vibration in every cell. So you know what we just did? We just rewrote the cell's program. We deprogrammed its brain and said, you're not sick, you're not unwell, you're healthy. So that's why everything's coming apart and it's not fighting with me. Did you get that?
Yeah.
If you can bring up your vibration, you can heal. If you don't bring up your vibration, you're not going to heal. Cancer's turned on by a frequency and it's turned off by a frequency. You're turned on by a frequency and turned off. If he's nice to you, you smile. If he's not nice to you, you go down. And me, I don't care if you're nice to me because I love myself. I don't rely on anybody to create my happiness. And that's the only way that you can have happiness on this planet. As long as people know that they can control you, you're in trouble, big trouble. And guess what? Your own family doesn't know that they're playing games with you. Your own family doesn't even know that they're running programs. But everybody's trying to control each other, right? Because everybody's desperate for love, right? If everybody had enough love, they wouldn't be desperate for it, and they wouldn't be playing love ransom, would they?
No.
Yeah, stop looking at your heart as a tank that everybody else has to fill. Hear it? But it's all coming apart, and it's not painful, is it? No.
Wow.
See, that's the difference. So understand something. So I just want you to know that the majority of the world is going to go from a limp to a cane, to a walker, to a wheelchair, to the nursing home, where they can be fed poison and then just die. Okay, and that's all it's meant to be. Hospital, hospice. Hospital, hospice. That's all that's meant.
Yeah.
And understand something. It's so easy to pay people to hurt people. Too easy, isn't it? There's no savior coming. Just know that. You got to save yourself. You have a brain, you have a spirit, and you have a heart. Process through your heart, not your brain, because your brain, you don't own it. You don't own it until you've taken a course like the Whole Life Coach, eh? Is that true? When's the first time you really started thinking for yourself? Was it after the Whole Life Coach?
Yes.
Yeah, that's right. So once you've taken the Whole Life Coach one time, it's over. You may not want to change and love yourself completely, but you know when you're being played. And you know that you're the one that played yourself the most, nobody else. Okay, we're not done, but just take your arm, move it around, see what it feels like. How's that feel?
Well, it's much better. I can lift it up. You can see it.
No, lift it. Really go crazy here. Go move it. What are you feeling?
I feel much better.
That's right. So now we just started. So now what we're going to do is I'm going to finish the arm, and then I'm going to come back here and work this, and she's going to go home, and I promise you that 90% of all her problems gone. Now, if she comes back in 7 to 10 days, one more time with Rami, and does the same thing, then she won't have to come back the third time for the Cellsonic. Just come back the third time for that. And if she goes home and does the crab stretch, and if she gets herself a clapper and claps it with our clapper, okay, and claps it every day for about 20 minutes, really get in there clapping it, and then put the DMSO rose cream, and then put the pain at least 3 to 6 times DMSO rose cream on it, and then put the pain away essential oil. Her arm will be completely healed in 3 weeks to 6 weeks. It's over. And it'll only be depending on, will she drink the structured water? Will she drink 3 quarts a day? Will she put black diamond into it? Will she do daily cleansing tea so she's having a good poop so we can lower the toxic load? Will she have 2 blender drinks a day with berries, okay? Something really high vibrational. Will she do 2 salads a day? And will she stop her addiction of the sugar and the flour? Okay? Right? Will you? Will you stop it? No, she's not saying anything. See, you know what? She's a cocaine freak, okay? Because that's what sugar's like, is like a cocaine. You see, she's like, I don't know, I'm going to do that. So what she needs to do, because we already know she's a sugar freak, because did you see her face? I don't know if I can do it. All she needs to do is put super cinnamon. It's called super cinnamon. Put it in her drinking water, 2 drops in every quart. And guess what? There goes her sugar cravings. And it'll balance out your blood sugar levels right away. And even diabetics can do it. Adult onset or even juvenile diabetes can do it. And it'll help to bring their insulin down. There's so much we could do for ourselves. Listen, it's all coming apart. Now, if she wants to spend the money, she can do the same thing. She can come back, and Rami can put the gel on her occiput where the whiplash was, and she can do 300 pulses back here and on her neck down to the cervical, and then work an hour in the occiput, and then she can work under the ear where the vagus nerve is and go in between the vertebrae and just open up the whole neck on both sides, and guess what? She'll say, I've never had my neck this loose. I've never felt like this in years. So you can either keep going back to the chiropractor every 2 weeks have them push it in and have it pop out. Or you can go for a massage where they're going to try to soften it up. And that's not going to work. Or go to an acupuncturist and just know, when I was very young, I became a registered massage therapist. Then I got my doctorate in acupuncture. I don't use either of them. Massage therapy makes you feel good, but it's not therapeutic. It's therapeutic on an emotional level, but it cannot heal. I put this technique together when I was 28. We're the only school that offers a money-back guarantee that I know of in the world. And we also offer a money-back guarantee to everybody who comes to us that gets a treatment. So let me see the rest of them do it. And here's the problem. Right here. Found it. See? Bicipital groove. Like I said. You always got to go to the bicipital groove. The bicipital groove runs the nerves that go down the arm and that gets damaged. Especially, it's usually the thing that gets damaged. Okay? So understand, everybody. You know, if you live in Dallas area, Rami, you're in Prosper, right?
Prosper, yes.
Yep. Just give Rami a call. What's your phone number?
214
214
549
549
3721.
21. And understand something. Everybody in this room needs non-surgical. There's not a person here that doesn't. Guess what? What if we were to teach every family, a member, how to do the non-surgical? What would happen? Well, there'd be no surgeries. There'd only be surgeries in car accidents and in sports injuries. There would never be chronic surgery again, would there? Because the only reason why we have chronic surgery is because the therapy out there sucks. And you know what? You've got to become your own therapist. That's really important.
Thank you.
You take care now. Okay, try your arm now. Show off. Any pain?
No, little bit, but not as before.
Like comparison. Are we down by 90%?
Yes.
That's right. So now I'm going to get rid of the rest of it because I've got to go back in here and right around her scap and just loosen that up and then it'll be gone. And I promise we'll do that now. Thanks everybody for joining us. I'm just going to focus here and do what I promised, okay? And understand something. You don't have to limp. You don't have to wear Depends. You don't have to drip. You don't have to stink, okay? You don't have to smell. You don't have to be stiff. You don't have to be puffy. You don't have to be inflamed, okay? You've all been lied to. How does it feel? Don't get angry. Just get even by eating right, thinking right, and doing right. And maybe check out my Braveheart Nation. Go to braveheartnation.com and come and take a course and get yourself on course. I'll give you a money-back guarantee that I'll blow your mind. Thank you. Good night now.